Welcome. My name is Rebecca. I'm one of the second years here at the USD Sanford School of Medicine General Surgery Residency Program.
And I'm Brooke Cons. I'm one of the fourth years.
Today we're excited to take you on a tour. We'll be looking at our lounge, our classroom, and our sim lab.
And then we'll be handing off to Brianna and Sam. Let's get started. So this is our resident lounge. This is where we spend a good chunk of our time during the day. We have a few areas back here and then another side over here. But just to start, this is our chief lounge back here. So this is where all the chiefs will have their desks and have their space to themselves. And then we have 3 call rooms back here. And they each have their own bathroom, which is so nice. So this is the first one. So you can see the bathroom, a nice bed on the side. Each has a fridge also. It's very nice on call that we each have our own space. And then there's 2 more over here.
Very similar, but they also all have a computer. So you don't have to leave the space if you get called out of bed at night. We'll head over to our lounge where we each have our own computer and desk. Hey everyone.
Hello.
Hi.
Hi.
All right, so here, again, your own computer and desk. Nobody else uses that space except for you. We have Sam and Cody, one of our first years, 2 of our first years. And then Brianna here, our 4th year. All right, so also our own printer, so we don't have to really leave and go anywhere in the morning. It's very, very handy.
Very nice.
You come, you sit down, print your list. You can change in the call rooms and get to work. It's really fast, so.
Hey, and we'll get to see you guys in a little bit when we hand off the tour to you too. And now we're gonna leave our lounge and head over to the classroom. So we typically have lecture on Thursday night and the classroom is just across the way, so it makes it really easy. And actually, today we have some residents over there ready to talk to you about the program.
I chose the USD General Surgery program because it focuses on rural general surgery, and when I was coming in it was a newer program, so I thought it would be a good opportunity to be able to kind of morph my own training. So now as a chief resident looking for general surgery jobs, I do feel like this program has been is set up for you to be successful in doing comprehensive general surgery and endoscopy, and being very well equipped to find a job and be able to be successful in it.
I did a rotation here as an away student, my 4th year of medical school. The camaraderie among the residents was very evident. I worked well with the attendings, and they were, they had good autonomy, appropriate autonomy, I would say.
So to jump off of what Brian said about autonomy, for example, this morning I just did a laparoscopic sigmoid colectomy with a junior resident as my assistant without my attendant really scrubbing any portion of the case. You know, at other academic institutions, this is a fellow level job, fellow case, where the fellow is going to be doing that and then the resident's probably being assisting the fellow. But in an institution like ours where we have no fellows, you get to do these type of cases and you get a lot more experience and comfort in the OR being able to do these cases. I find this very important, and this is probably one of, or if not our strongest aspects of this program is the autonomy and progression in the OR to be able to do fellowship level cases as a resident. Because it just sets you up for success when you go out to the working field.
Yeah, even if you don't have, you might do a fellowship level case, but it may be probably more of an attending level case. Like I just came down from doing a big tumor resection in a pediatric patient, and I got to first assist. I got to do portions of the case. And at a different institution, I'd probably be standing on a step in the background watching. So, with all of our subspecialty rotations, like Dr. Marquin said, there are no, fellows. So you get to jump right in. You get to be right up at the table, and do portions of it, and you develop those relationships with the attending surgeons.
Yeah, and I actually would want to jump off that and talk as an intern for the operative experience. I know a lot of places you won't get very much operative experience. But I just came off of the acute care surgery and trauma with Dr. Marquin, and there were 3 laparoscopic appendectomies that I did basically by myself. Dr. Marquin was scrubbed in with me and kind of going through the case and showing me what to do. But I would say I was the primary surgeon on those cases and did the entire all critical portions of the procedure, and that was just within the first couple of weeks of starting residency. So you get to do great cases as you progress along, but you're still getting in the OR quite a bit as an intern, which is great.
Yeah, we really try to focus on getting interns early exposure to the operating room. So if you come here, you'll be in the operating room as we just talked about.
If there's one thing I want you to know about this program is that if you come here, you will become a true general surgeon. The fact that we don't have fellowships here, you get to rotate through all the subspecialties, and you really do get hands-on training in all aspects of surgery.
Hope you learn more about the program. We'll continue the tour with our sim lab. All right, and here we have our sim lab. Behind you is our Symbiotics lap and endoscopic trainers. And then we have 4 FLS trainers where they each have their own surgical instrumentation, and this is open all the time for access. All right, Brooke.
Okay, and then we're gonna head back upstairs to the clinic to meet up with Sam and Brianna. And now we're at the clinic, and oh hey, there's Brianna and Sam.
Thanks, Brooke and Rebecca. Sam and I will take it from here, all right?
Sounds great.
We're gonna go in and talk to Dr. Tamby and Amber. So here we are at Dr. Tamby's office. Dr. Tamby is our program director and kind of our go-to person for the program. So his office door is always open. Anytime you have any questions or concerns about the program, he's available to help sort through that. And it looks like Amber, our program coordinator, is here as well to help out. So I'll take you in and introduce you.
Hi, Brianna and Sam. Amber is here, our program administrator, and welcome to USD Sanford School of Medicine General Surgical Residency Program residency tour, and I hope you get to see most of our hospital parts, and then I look forward to seeing you all at the interview tour, and I'll let Sam and Brianna take you guys back on the tour, and see you soon.
All right, now we're up here on the 2nd floor, which is where the ORs are located. One of the really convenient parts of this program is that on the ground floor is where our residence lounge is. The 1st floor is where the clinics are, and the 2nd floor is where the ORs are. So there's no traveling to go to clinic. It's just all right here in this same area, which makes it really convenient. So now we're gonna go ahead and show you the ORs right this way. One of the great things about this program is that you really do get early operative experience as a PGY1. Just in my first couple months here, I've had a lot of experience in the ORs and have really been able to learn a lot through that.
And that's one of the great things about this program, like Sam said. You start as a PGY1, getting in the OR and getting that experience, and then as you move up, I'm a 4th year now, I've gotten a lot more autonomy in the OR, and I feel like that'll really prepare me to be a general surgeon and go out and practice when I'm done. And so that's one of the reasons I picked this program and one of the things I really love about it. So let's go back and take a look. So this is one of our robotic ORs. We have Chris here, he's one of our 2nd year residents who's practicing on the robotic console. We have a dual console system, and so you get a lot of back and forth with the attending and get to learn to use the robot using that. We have about 40 ORs here. That's not including the GI suites. It's a very, very busy OR space, so lots of cases and lots of learning for our residents.
Okay, now that we have shown you guys the ORs, next stop is going to be the Surgeon's Lounge, which is very conveniently located right outside the ORs. This is a place where in between cases you can go and get snacks, sandwiches, salads, drinks, what have you. And this is of course separate to the Physician's Lounge, which is where we have our meals, which are both breakfast and lunch, which you're able to go and get food from there at any point. So let's go ahead and show you the Surgeon's Lounge. And we are back in the surgeon's lounge, which as you can see is very well packed with pretty much any type of snack you can think of, including chips, sandwiches, fruit, cereal, and drinks, including soda and coffee for your needs. Surgeon's lounge is a really common place for the surgeons in between cases or before the day. We'll meet up and talk about things that will be going on during the day. For example, we have Dr. Vong here, one of our neurosurgeons. One thing that's really convenient about this is we are located about 10 steps from the operating rooms to my left there. And also finally, you can see out this window here is where the Peds hospital is. And as in your second and fourth year, you'll be doing some pediatric rotations in that hospital right over there, which is commonly referred to as the castle because it does look like a castle. So we're gonna go ahead and show you that now. So here we are, which is the walkway into the pediatric hospital, or like I said before, the castle. The castle was built with pediatric population in mind, so there's a lot of kid-friendly murals. The windows are lower than your average types of windows, and it's not just a hospital that was made into a pediatric hospital, but it was a pediatric hospital that was made for pediatric patient population.
We have 3 peds surgery attendings that we work with and on the peds rotation. Dr. Reichman, he's the associate program director and one of the pediatric surgeons. He's great to work with, and all the peds surgeons are great to work with and learn from. While in the castle, you'll spend some time in the PICU. That's where any patients after surgery that need some intensive care go, and that was a great experience for me. We also have clinic space, which was designed with children in mind and is a great place to learn about pediatric surgery problems.
And now we're going to go ahead up to the physician's lounge where we're going to finish out with Wes and Michael, who are 2 other residents, and show you the physician's lounge, which is where we have breakfast and lunch.
So this is a great place to meet up with your team and kind of talk about your day and have a cup of coffee and something to drink. Looks like we have Wes and Chris here to finish off the tour.
Hey Bree. Yeah, Michael's caught up in a case, but me and Chris will finish up the tour for you.
Sounds great. Wes is one of our 4th year residents and one of my co-classmates, and Chris here is one of our 2nd years. Thanks for finishing off the tour.
Happy to do it. All right, to finish out your tour, we're going to take you through a couple of our inpatient units. We'll start out on our surgical floor, then we'll go to the surgical ICU, and then we'll finish things off in the heart hospital. All right, let's do it. All right, welcome to our surgical floor, where you could potentially spend a large portion of the next 5 years of your life. This very much becomes a second home to the residents while we're managing our patients who are admitted. One of the nice things about our surgical floor is that our surgical nurses are well accustomed to taking care of postoperative patients. We also have an excellent charge nurse system that saves you from being called about everything clustered over the entire course of the night, and instead all the calls are grouped together when it's not emergent. Chris, how do you like the system that they have going on up here?
As I just came off of being an intern, it does work very well. There's a lot of learning opportunities for sure. Fortunately, we do have Epic here, which is, in my opinion, one of the better EMRs. That's one that I'm most familiar with, and it makes, there's ways you can incorporate efficiency into your day to help you out as an intern especially. And like Wes has mentioned, the staff here we work very closely with, including our APPs. Kylie's one of our many APPs that we work closely with. Especially as an intern, they're a great resource for us, kind of keep us from making mistakes and kind of encouraging our learning as well. And next we'll head into one of our typical inpatient rooms on 2000. Before we head up to the ICU, as you can see here, this is a single room. All of our rooms at SMC are single rooms. We have a computer that's readily available in the room for increased efficiency of placing orders and getting things done right away in the morning, especially when we're rounding and going off to cases. And then next we'll head up to the ICU. We've just come up now from our inpatient floor to our surgical ICU. This is a place where you spend time early on in your training as an intern and then progressing through. It is quite convenient as far as physical space because we can transfer patients relatively easily. Either if they're down on the floor and needing higher level care, we can rapidly bring them upstairs, or if we're transferring patients that come in that are acutely sick and are improving in their quality, we can transfer them back downstairs without too much logistical difficulties. And it also makes kind of the flow back and forth quite easy. This is our typical bed setup here. As you can see, it's kind of a standard ICU room. And next we'll be heading over to the Heart Hospital. It's a place that you spend more time there when you're more of a senior resident or junior resident, when you're on your vascular or cardiothoracic rotations. That is a newer building over there. It's kind of unique in the terms of it is both an ICU and an inpatient floor kind of all in one unit. So it's acuity adaptable is what we have described it as, meaning the patient stays in that room, they can receive ICU care and then transfer over to floor status without actually leaving their room. We'll be heading over there next and kind of give you a little bit more insight in that building that we have.
I'd like to introduce you to Dr. Paul Bjordal. He's the trauma director for our health system.
Hi, welcome. Here at Sanford, we have the largest trauma program in the state and really one of the busiest flight programs in the country. Over the last several years of growing a residency, we've started to develop a relationship with the residents where they've become a really vital part of the team. So when you start here, you're immediately immersed and you become a really critical part of that team and that patient care early on.
Thanks, Dr. Bjordal.
Thank you. Next we'll head off to the Heart Hospital.
All right, now for the last stop on our tour, we have the Heart Hospital. This is one of the newer portions of our hospital, and it's actually being further expanded. This is where we have the adaptable acuity beds, where a patient can go from floor status to ICU status and back again without having to physically move anywhere. That's both convenient for the patient and for your rounding team, since you don't have to figure out where your patients have gone to. These rooms are also one of the areas where you spend more time as a senior and where you spend more time on your vascular rotation and your cardiothoracic rotations. Well, thank you for joining us on the tour today to see our facility where you could potentially be training to be a surgeon for the next 5 years of your life. I've certainly enjoyed my time here.
As have I. One of the big things that brought me here and certainly kept me here as I was a medical student here is the early operative experience and the camaraderie that we have between the resident group.
We look forward to you joining us as an intern next year, and we wish you the best of luck in the coming interview season.